Well, winter is certainly arriving, and there is often an increase in RSV. But this year, the virus made headlines a lot earlier than ever before, and even our local hospitals are seeing an increase in the virus. For most of us, RSV is just a bad cold, but for older folks and for young babies and such, RSV can be severe. So as we prepare for the holidays, we're sitting down with an expert to learn more about how to protect those we love from the virus. Please welcome Dr. Carol Kao from Washington University Infectious Disease. She's a specialist and at St. Louis Children's Hospital. We're so glad you're here. We've all been through this as parents with kids. These respiratory viruses can be so difficult. So tell us about what you're seeing with RSV cases at St. Louis Children's Hospital.
So as you may have heard, we have had an unusually severe and early RSV season here in St. Louis and really across all children's hospitals in the United States. We started seeing RSV early in the fall, and by October we were having 5 times the number of kids hospitalized for RSV compared to this time last year. And currently we continue to have very high rates of RSV, record number of kids being hospitalized for RSV, with some of those even requiring ICU care.
Now, is it reasonable to think that it's probably going to get worse before it gets any better as we head into the holidays and the really cold weather season?
As you may have heard, we are seeing tons of respiratory viruses circulating around right now. So on top of RSV, which has been pretty steady, we are just now starting to see influenza come into our community. So likely the number of hospitalizations and respiratory viruses going around is going to get worse before it gets better.
Why do we think that is? Why is this season so much worse?
Yeah, that is such a great question. So because of the pandemic and a lot of the mitigation measures such as social distancing and masking that were implemented, we saw virtually no RSV in the winter of 2020. So a lot of kids that normally would have gotten exposed didn't. Then as these were gradually lifted, we did see RSV in the spring and summer of last year. And then with this year, with everybody being back in school, in-person learning, social activities, at the end of the summer, we started seeing large numbers of RSV and other respiratory viruses.
And probably the same thing applies to the flu as well. I mean, people were protected from each other, social distancing and such, and now we're seeing more gatherings.
Yeah, you're absolutely right, yes.
We talked about croup cough in the break because that was something I dealt with my kids, and I always worried about when we should pursue some kind of a treatment plan with either to the ER or the pediatrician. What do you suggest? When should parents call the doctor or call the hospital?
Yeah, my 1.5-year-old actually just got over RSV.
Really?
So as a parent, yeah, it can be very scary. I understand. RSV typically peaks in the 4th to 5th day. Vast majority of kids do fine just on their own. However, some, especially infants, can really get into trouble. So I would definitely recommend they call their pediatrician or see a healthcare provider if their kid is getting dehydrated. And for infants, that means they're making less wet diapers than usual, or if they're having difficulty breathing. So that means they're visibly having very quick breathing or very shallow breathing, loud wheezing when they breathe, or struggling to breathe.
It's a scary thing. As a parent, it's a scary thing to hear your kids struggling to breathe. And so don't hesitate to call your pediatrician and start down that road. Thank you so much.
Thank you.
Have a great holiday season.
You too.
We will post this segment on KMOV.com/greatday following the show.
Important to stay on top of this, Dr.